Hello, my name is Jennifer Plant, and this is my final presentation for neurobiology. The title of my presentation is From Ceremony to Synapse, the Neurological Impact of Ayahuasca in Mental Health Treatment. I will start by saying that recording myself makes me extremely uncomfortable. It is not something that I enjoy. I compare it to trying on bathing suits in a Target changing room. Not something I would recommend. So you'll have to bear with me. And I will also say that from time to time, I'm finding myself tripping up on the pronunciation of some of the words needed in this presentation. So you'll have to excuse me on that as well. But anyways, here we go. Thank you. So where it began for me and the reason I wanted to study this topic and to do the research project on this particular topic was because of my brother and sister. We have trauma in our family, in our past, and this particularly, it was particularly hard on my younger brother, and things were getting pretty bad for him. And he and my sister decided to go to Costa Rica to try ayahuasca and to do an ayahuasca retreat. And this was sort of a last ditch effort for him. And having done it, they had a lot to say about it. They really believe in its effectiveness as a helpful tool in treating mental health. They swear that a lot of their issues have resolved, and they feel a lot better. My sister in particular suffers from a lot of gastrointestinal issues due to anxiety, as do I. And she says that those issues have all but cleared up since having done this. My brother has gone back a couple times since then. That was a couple years ago that they first went. They were kind enough to share these pictures, a few pictures from their trip with me, to kind of give an idea of what it would look like if you were to go to Costa Rica and partake in one of these ceremonies. This is kind of the grounds and the area in which they were. This picture I found to be quite poignant. This was a quote that was on the wall in the room that they were staying, and it said, "The shortest way out is through." And I just found that particularly poignant to have an understanding when going into this, that it's going to be ucky, it's going to be hard, but you've got to go through. You've got to go through the muck and the yuck, maybe to get to the other side successfully. So that's really the purpose and the point of what they did there, and how they basically described what their experience was for them. So to start off with, I feel like it's important to really discuss what ayahuasca is exactly. So ayahuasca is a word that comes from the Quechua language, again, pronunciation. It's spoken by the indigenous peoples of the Amazonian areas of Peru and Ecuador. It goes by a few different names. It's been called huasca, pharmahuasca, kepi, La Purga, the Vine of the Souls, the Tea, Nishi, to name a few. And it's a powerful psychotropic South American plant that is made into a tea. It's traditionally prepared, from the Banisterope capi plant, which is an hallucinogenic plant belonging to the Malacophyceae herbal family. The stems of this plant are boiled and then consumed in a tea-like substance. As I said, ayahuasca is not known for being particularly pleasant to drink. From what I've understood and what's been explained to me, is it's quite bitter, not very pleasant at all. And this unpleasant taste, combined with the effects that it have, can cause extreme vomiting and sometimes simultaneous diarrhea. Which does not sound like a fun experience to me. But it's been explained to me, and through my readings as well, that the participants almost welcome this sort of purging, that happens because it's a purging of the negative energy within you. It's a purging of the trauma. And they said you can feel yourself releasing all of that through the vomiting. So they say that's a good part of it, but I don't know. So moving on, we have this slide that kind of breaks down really, we've got the plant right here off to the left. Then we've got the pharmacological properties of the different elements of ayahuasca. So we've got I'm just going to say DMT at the top because I cannot pronounce that word. Then we've got the harmaline and the harmine, which all make up the ayahuasca. And that's been found to help with psychotherapy, anxiety, attention deficit, depression, different neuroses, cancer, addictions. So really been found to help with a large manner of things. With this next slide, we get into how it works, on a neurological level. And we have the presynaptic membranes and the postsynaptic membrane, and we can see exactly how the mechanisms of the harmaline, and the TH8 at the serotonin 5-HT work. Excuse me, and the dopamine pathways. And so we can see really how that's being transmitted and how it's going through from the postsynaptic membrane from the presynaptic membrane to the postsynaptic membrane. So we can really see that process and how it's received. Over here, we can see from this other picture that it really has an effect on many different parts. So obviously neurologically, also works on a gastrointestinal level, just a lot of different areas in which it has a positive effect. It does have some negative effects, and we'll get into that in the next slide. So in speaking to those negative effects, it is important that if someone were thinking of trying this, that they're aware of any pre-existing conditions that they may have. There have been reports of increasing blood pressure. So, adding to really high blood pressure, as spoke to before with the gastrointestinal issues, it can really upset your stomach and cause extreme vomiting. So someone might want to be careful of that. There have been reports of cardiac arrest in a few patients. So maybe pre-existing heart issues, that might be something that someone wants to consider. And not last but not least, we also have, the extreme hallucinations that would accompany ingesting ayahuasca. And when you're searching and researching about ayahuasca, you are going to come across other substances that they've been using more in treatment, like ketamine, LSD, psilocybin. They all have similar properties, and they all have similar ways in which they are helping patients to overcome different issues, again, like anxiety and depression, PTSD. They all work in a similar way, combined with mental health treatment and therapy to help patients through and have better outcomes. So really, at the end of the day, it seems as though ayahuasca can really be an effective mental health tool. I think it's important that it's combined with effective therapy. It's not something that you'd want to do on your own. It's very important that it's done in a professional setting. You want to make sure you're with trained professionals that know how to help you and know what to do, and in case something were to go wrong. It does show optimistic results. And I think that, maybe this ancient medicine has a long way to go in terms of use in a clinical setting, but it is increasingly easy to see how that may just be possible. Thank you so much.